Good morning. My name is Dalinda Guillen, and I serve as your moderator this morning on a very important panel, the economics of healthcare. Obviously, our goal this morning is to have a very good discussion with some very, very valuable guests who are going to give us their perspective on what we can do to grow our community, to seek opportunities in healthcare for Stark County. And I am going to take a brief moment to give you some housekeeping rules. If you remember from the panel earlier this morning, we encourage you to use your phones throughout the panel, but please silence them out of respect for our panelists. There is a handout at your seat that has a URL code and a QR code for a survey that should be completed before the end of our panel. So please, I will remind you again at the end to go ahead and answer a couple of questions for us that will be reviewed and discussed in the afternoon. So now this conversation is with a very important group of panelists, and I'm going to take a moment to introduce them to you. Excuse me. We have with us here this morning some very distinguished physicians, and I will begin by introducing Dr. Antonio Falcon, who is owner of Family Health Clinic in Rio Grande City, also former Texas Family Physician of the Year. Next to him, we have Dr. Jose Vasquez, who is the chairman of the Stark County Memorial Hospital Board right here in Rio Grande City. And lastly, we have Dr. Carlos Cardenas, who is CEO and chairman of DHR Health. Some of us still call it Doctor's Hospital at Renaissance. We have these gentlemen here to answer a couple of questions for us, but as I get into that, I want to say we have a group of audience members here in, it looks like maybe are studying nursing here at South Texas College. And so you'll probably want to hear a lot of this discussion because we're going to talk about jobs and opportunities in healthcare for our region. I will pose the first question to our panelists, and we'll begin with Dr. Falcon. Good morning.
Good morning, Linda.
As a healthcare provider and large employer paying above our region's average wages for a vast spectrum of employee types, what is your perspective on the future of healthcare industry and its impact as a critical quality of life factor?
Well, thank you for asking that question. But first, I'd like to just make a few comments. 51 years ago this week, Celeste, you know this because we grew up together, I was pitching watermelon right here where STCC sits. And it's just amazing, even though it's been 50 years, the transition of the landscape over the years. Mm-hmm. And in my life here, I've spent 40 years of my professional life here, this has probably been the single most important event to create economic activity, growth, and prosperity for our community. And for those that were involved in the initial phase of trying to get STCC to have a campus here on Rio Grande, we should be eternally grateful. In response to your question, I'm really honored to sit with these two gentlemen who know a heck of a lot more about the economics of medicine than I do. I'm one of the grunts that practices family medicine. So I can give you a perspective of what it's like from a family doctor. And certainly any business, especially business, is linked to the development of the economy of our community. We have seen it, we've seen some growth with a hospital, but we have seen enormous growth over the last several years with the association and affiliation with Doctors Hospital. That's given us an opportunity to expand services immensely here in this community. But we also have seen it in the periphery of healthcare. In our practice, we have probably 4,000 patients that are of Medicare age, all right? And we probably have 3,000 patients that are over the age of 80. And I know we have at least 2 patients that are over the age of 100 because we saw them last week at the office. So our population is aging, and it's aging, and the proportion of elderly continues to grow significantly, therefore needing more durable medical equipment, more nursing homes, more home health care, and the services need to be available for geriatric patients. As that segment of our population grows, more people are needed to fill in the needs for them: physical therapy, speech therapy, nursing, and so all of that fits in together to the incredible needs and growth of our community. We have a very interesting situation in Hispanic health, and I know Doctors Hospital is trying to lead the country in the research of healthcare for Hispanics, and I'm sure Dr. Cardenas will talk about that later on. But we have a population that's actually older than the average population of the country. And because of that, the healthcare needs of Hispanics is much, much greater. The older you live, the more you need healthcare of different kinds. So, long answer to a very short question.
Thank you, Dr. Falcon. Obviously, the demographics of our community does pose a need for additional healthcare, access to healthcare, and I appreciate your response to that. Dr. Vasquez, how would you answer that question? What's your perspective on the future of the healthcare industry and its impact as a critical quality of life factor?
Thank you very much. Thank you, Ms. Guillén. Thank you to all the audience. I want to take a couple of seconds to thank the people who had organized this magnificent event. As Dr. Falcon mentioned, this is an enormous opportunity that we have in our county to take steps towards the future, to take the necessary steps to continue growing in a fastest and speedy way. I want to mention Ms. Benavides, Ms. Elizondo, that very graciously invited me to this event, and it's an honor being here with these 2 very accomplished physicians as well. So answering your question, Ms. Guillén, I want to give a little bit of a perspective of what has been the development for the Starr County Memorial Hospital, as well as the rest of the community under the public health plan of view. In the last 20 years, our hospital has grown tremendously. We have been the only hospital district in the whole South Texas area for about 40 years now. That has given us ample opportunity to have funds and to have the ability to raise funds in order to serve the community that we have. To give you a few numbers, from year 2000 to now, we have grown about 3 times. Our budget is 3 times more than what it was 20 years ago. Our funds, or general funds, are about $50 million when they were about $16 million 20 years ago, and that has represented an enormous influx of money in a much-needed community. We employed 20 years ago 160 people. We employ now over 290 people. That represents 290 families in this small community that had a steady job with wages higher than the average for this community. We had invest in infrastructure as well as in growing in the number of services that we provide here. We are happy to announce that we had established significant partnership with bigger entities in the Valley as well as in the rest of the states, always in order to promote the health care of our community. I'm proud to say that we are in an affiliation agreement with Doctors Hospital of Renaissance, where we are able to provide much needed services that otherwise we could not afford having them here. We have surgical services, we have emergency room services, we have a hospitalist program, we have gastroenterology services, we have a multiple variety of different specialty and subspecialty services that are being provided in our county. I think that this is important, and this will lead to some of the other questions that we are going to have in the future here in this workshop, where much of the need that we have to serve our community is going to come through all of these partnerships and affiliation with bigger entities throughout the valley or the state. For us to raise the resources necessary for the growing demand on services and the growing population every day becomes more difficult. So it is just through this affiliation and partnerships where we are going to be able to keep growing and continue serving this community as well.
Thank you very much, Dr. Vasquez. Dr. Cardenas?
Well, good morning, and thank you for inviting me to be here. I can't tell you how proud I am to be here, to serve with these two men to my left. And that sounds like a mutual admiration society, because it is. The basis of healthcare, the foundation for the future, is sound because we have people like Tony Falcon and Dr. Vasquez. They're both primary care physicians. That is the foundation of what is a medical community in any community. And I want the audience to think about a couple of things. One is that we're talking today about Starr County, but we only have divisions because we've created those divisions that were, to a certain extent, decided for us because we have county lines. But we're truly one region. Think about it. Willacy, Cameron County, Hidalgo County, and Starr County are an area. We are a region that is geographically and demographically isolated from the rest of the state. We've been treated that way and seen that way by the federal government, by the state government, and only until recently did we elbow our way on to our place at the table. So I think the future of healthcare, in answer to the question, is sound moving forward. I think that the examples of what we can do when a community makes the decision to do certain things to build its infrastructure, its human capital, which is what this community has done, which we've done in Hidalgo County, which we've done in Cameron, and we're affecting all of our area, has made it possible for us to come from where we were 50 years ago or 70 years ago to where we are today. And the future, in my view, looks very, very bright. And, you know, I don't want to answer all the questions at once, but at least from my perspective, there is a lot of success that has been achieved because of what we talked about earlier this morning, and that's vision, the ability to see beyond the budgets, to see beyond the things that we think hamper us, but to build on what is the true future, which is our youth and our community. Don't let anybody ever tell you that we don't have the intellectual capacity or the intelligence in our communities to be able to build the leaders for the future. Because you're looking at some of them sitting up here, and there are others in the audience who have the same vision to make this community of 1.4, 1.5 million people no different than any other major metropolitan area. It's what we deserve as a community. I am blown away by this facility. The step that STC took when it took to put a facility here is a game changer. It was a game changer in Hidalgo County. We now have the ability to train the next generation of workers who are going to be required to have a certain level of education to participate for what we'll talk about a little bit later, I think, in some of the questions, of what I see as a true transformation of the delivery of health care and the jobs and economic development that it'll bring.
Thank you, Dr. Cardenas. There is no doubt that the expansion here at South Texas College, especially with their nursing program expansion right here in Starr County, has made a significant difference. I believe, and serving also on the Workforce Development Board, we see those trends in the healthcare industry and jobs in the healthcare industry. And so we know that training is necessary. And so I know for firsthand from family and friends who are studying healthcare that, you know, the traveling to and from McAllen becomes a hardship. So I applaud South Texas College for having that vision of coming right here to Stark County with this nursing program, because I think it's going to be a huge game changer for us here, especially as we grow as a healthcare community with all of the developments and advancements that our hospital continues to make. And so that leads me to the next question. Well, Dr. Cardenas, we'll start with you. How can we continue to innovate to better prepare to meet the demand of building a skilled workforce for the healthcare industry?
Well, I think that one thing that we can do is to identify early. And I'm not an educator, and I don't truly understand how that's done, but for those of you that are educators in the audience, you can help us with this. And that's the early identification of those who have an aptitude for a career in the healthcare professions. And to build upon that, cultivate that interest, and then develop the what I consider to be the very important STEM-related fields, and I mean science, technology, engineering, and medicine. That background in what is going to have to occur to have the workforce for the future. The transformation that's coming, what I'm alluding to, is that this is not necessarily an experiment anymore. We have, I think, proof in San Antonio of what happens when you bring a medical school to an area in a region, and the biomedical industry that develops around that school because of the professors that come and the basic scientists that you need, and all of the infrastructure that has to be built to support that. That infrastructure needs workers, needs people to step up into those areas, and that requires a certain level of education and workforce training. Looking into the future, if we identify those people early in their careers, create shadowing opportunities and mentorships, I think we can build that workforce for the future. There's no question what it's done in San Antonio, I think, can be repeated right here. I think it's going to happen quicker here than it did there.
Thank you, Dr. Cardenas. Dr. Vasquez, how can we continue to innovate to better prepare to meet the demand of building a skilled workforce in healthcare?
Thank you for the question, Ms. Guillen. I think that the efforts that the education institutions throughout the valley have made over the last 10 or 15 years have been tremendous in trying to accomplish that goal. The fact that we do have now in the valley a School of Medicine, it represents a tremendous advance in trying to achieve that purpose. The work that institutions like this, the STC, UTPA, or UTRGV have done in the valley into growing nursing programs, but not just nursing programs, all of those professions that you need to have in order to be able to provide an efficient healthcare system, lab work, pharmacy, ancillary services, pulmonary service, respiratory therapies, so many different things that you need to have in order to provide an optimal service. Those are careers that have been developed now over the last 10, 15 years here in the valley, where before we didn't have them. So I think that as a part of a whole bigger plan is a very important contributory factor. Other thing that we like to mention, and here more at our local level and Stark County level, I would like to see the families encouraging their children to come back to the county. We have so many bright kids that go out of the region to study and to get educated away from their homeland and then staying there. I would like to see all of those children return to serve their communities, and we would like to see different programs or incentives for those children to come back to their hometown. At the hospital level, we have been doing loan repayment programs. We give scholarships for people going into healthcare education, call it nursing, pulmonary services, or medical school. Okay, so I like to see more of this to keep the incentive over the children of those families that are from here coming back to serve their community.
And meet our, obviously meet our need for their skills in our community. Absolutely. Thank you. Dr. Falcon?
The only thing that I'd like to add is that now that we have a medical school in the valley and a flagship hospital, DHR, that is encouraging the school to move forward, is the absolute need for research to see what we can anticipate in the future. And this country in general has lacked in the resources of studying Hispanic health, especially Mexican-American Hispanic health. As we know, there are a lot of different Hispanics in our country, and we're not all the same. We are not Puerto Ricans, for example, and our health is different. And so now we have the ability to start projects, not so much to know whether there's more diabetes in South Texas or not. I think there have already been 1 million studies that have showed that. But what do we do about it? And when do we start that? And once that research is started and we see what is happening, we will be able to change things, maybe even as early as kindergarten or in our schools, to change the outcome of a certain condition 20 years down the road. And that's where I see the key of the pathway to tomorrow. It's going to be through research, because we don't want to do things because we think. We want to do things based on good science. And we're, I think, in a few years going to start having that.
I'm sorry. Are there any other examples you'd like to provide as evidence that significant progress is being made? I know we've talked about the medical school. Is there anything else that comes to mind, Dr. Cardenas?
Sure. I think Tony certainly alluded to it, and is absolutely on point. We have a tremendous opportunity in the Rio Grande Valley to be the pace setter when it comes to treating and identifying diabetes and diabetes-related problems. Liver cancer, we're ground zero for that. We have more of it in our area than anywhere else in the country. We have probably more non-alcoholic related fatty liver disease and all of the problems that come with it than almost anywhere else in the country. We're going to solve that problem down here. We're going to get that one figured out. We already have trials that have begun. That's an example of things that have started. We have several trials that began in our Liver Institute. We're enrolling people every day in those studies that I think will help to bear fruit for the future. A bigger question, I think, for us as a community that all of us need to answer and a challenge is the lack of what we call health literacy, that our population really doesn't understand the factors that are driving some of the problems that we have in our population, and some of the research that needs to be done in that area at the same time that we try to raise the level of literacy in health and in healthcare related issues to help ourselves, help our own population. And so I think that if we can build institutions, we can do a lot of different kinds of things, but we've got to get to the heart of the problem. And the problem for us is to identify those things in our population and then be able to teach our population how to help itself. And medicine is one of those few businesses, and if you look at it as a business, that tries to put itself out of business. Great business plan, right? But that's the truth. I mean, because it's what drives us. What drives us is the willingness and the desire to help our fellow man, to help our patients be better and be healthier. And I think it all revolves around health literacy and the strategies that we as a community develop to help solve that problem.
Very good point, Dr. Cardenas. And we do have some group we have someone in the group that is an advocate for health literacy. Ms. Morado with the Ag Extension Agency is continuously.
South Texas, that wants to partner with Dr. Foster. And we have program assistants, and we're working in schools. We have something like 36 gardens. Also in the community gardens, because it's so important to teach the children. And you would be surprised, Dr. Falcon, when they eat spinach and kale, because it's out there, they grow it, and they take it into their diet. And that's what we need to it's almost impossible with some of the parents. You know, they're already, you know, into a track where it's, you know, high carbs and a lot of that. But with the children, and we work with the food service directors, and they are awesome. They take the actual vegetables that we're growing in the gardens and putting it into the cafeterias. And the kids eat it and they prepare it. So it is just, you know, we're working slowly and we're getting some new grants. I have a new grant from the Farm to School program, and then I have a big CDC grant. And it's also, and I'm so happy about the imaging center that's coming into the hospital. That is going to be awesome.
Thank
It sure is.
Because we have a lot of problems with diagnosing cancer patients, you know, that I have here. So I'm ready to work with you. It's awesome. We have a staff that's very eager. And I guess Dr. Falcone, we go way back.
We do, that's right.
I was giving him rides from A&M when he was in school. Goes to show my age.
Thank you, Ms. Morado. Dr. Vasquez, is there any other examples that come to mind that you can provide as evidence that progress is being made?
Definitely progress has been made. I've been here in this county proudly for 20 years. I have made all my professional career here, and I have seen day after day how this county is been growing, and especially on health-related issues. I think that just brief examples of what shows how much have we grown is the number of people that we are serving, not just in our county, but in the region as a whole, okay? There is been tremendous improvements in the services that is being provided in the South Texas area that are comparable to anywhere else in the state or in the county or in the country. At our local level, affiliations with doctor hospitals of Renaissance, with nursing home facilities where we right now operate 8 different nursing homes throughout the state of Texas, helping those communities as well as helping our community to provide services for the elderly and needed are a significant example of what we've been trying to do to achieve those goals. Services that we never dreamt about are going to be provided here on a continuous or daily basis. We are about to break ground for a brand new state-of-the-art imaging center, as Ms. Morado said, and thank you very much for reminding us that, which we are very proud of. It's a much needed service in this community. We are trying to facilitate for the people in Starr County to have their service here. And that somehow has been a challenge because as time goes by and throughout the years that I've been here, I have seen a reverse trend. When you will expect that more people will be served in this community, we are seeing that that's not the case. And when you try to explain those facts, you have to see that in the rest of the valley, the population as well as the system has grown in a disproportionate share with respect to us. So that draws people to other areas like McAllen or Mission area or Far area to seek for services. Well, that's something that we are looking to change. We are looking for those services to come to us rather than us going to them, okay? And that is going to be achieved, one, through all of these partnerships that we are trying or we are currently establishing, but also trying to educate our community, to teach them that good, efficient, and state-of-the-art services are and can be provided here in our community without the need to travel away. So we will continue doing this. We will continue trying to stimulate our children to get in the healthcare industry, to pursue education in healthcare, to keep their service in their community, which is much, much needed.
Thank you. Thank you, Dr. Vasquez. Dr. Falcon?
I agree with what they have to say. We're in the process, 2 of my kids are in the process of discussing coming to work in the Valley with Doctors Hospital. Hopefully those discussions will move forward and we'll have 2 more local kids in the physician workforce here in the area. I'm all in
Excellent.
favor of it. I want more grandkids around the area here, so.
As I was about to add, 2 more doctors and a couple grandchildren closer to home, right?
That's right.
Okay, so moving on to our next question, Dr. Falcon. What is the biggest challenge in the healthcare industry at this moment?
In our area, I think the biggest thing that I see from my point of view is the problem with diabetes in childhood and childhood obesity. I think for years, some of us have been trying to change that. And again, the lack of research has hampered our abilities to move forward with that. We don't need to find out if there's more diabetes or obese kids in South Texas. We know that. What do we do about it is the next big giant step. I know that there are some people very actively involved in trying to help, but I think it's going to take a greater effort of more people, the hospital working together, public health working together, the commissioner's court working together, the city commission. Is going to have to be an effort because we're facing a major issue. When I got here to Rio Grande 40 years ago, we didn't have one single type 2 diabetic in our schools. We had type 1 diabetic, the insulin-dependent diabetic. It's my understanding, I don't do pediatrics anymore, that we have over 200 children with diabetes in our school district right now. 200. Do you know the numbers? What do you have? Isn't it about that? Uh-huh.
We did a program at one time when we identified them in the school. Gloria Smith was pregnant with this. She's a counselor. And we had a program where we had, a nurse and a counselor and all of that working with us. But then they would drop them off. After we identified them that they had the acanthosis and they needed further, support within the school, like with their diet and with the counselors and stuff, we lost the funding and it just went down the drain. But if we could identify them at an early age and then work with them, we could probably get it in control. Because, some of these kids are already on insulin. When they hit junior high and high school, that is just unreal.
And the time to make a difference is
Now.
at this age that we're talking about.
Yes, it has
That,
to
I think,
be.
is the biggest need.
And
we
it's
have.
the diet, and we have to work also with the food service directors, because the foods that are being served, it's all prepackaged. There's a lot of carbs and all of that kind of thing. We need to just make some effort.
One of the things that I've always been concerned about is that we're feeding our children too often at school, because children will eat at home, then they'll have a breakfast, then they'll have lunch, then they'll have a snack, then they'll go home and eat. And nobody's ever looked at that and said, can we separate that and say, we're not going to be feeding kids all day long at school. They're going to be studying. Let them eat at home. And if they need extra resources to buy the food they need, that's a different situation. But that's never been looked at. But we know that it's a calorie problem. And Carlos is a gastroenterologist. He might be able to tell us about that. But to me, it's a food problem. I know that when I was growing up, our refrigerator was always empty at the end of the day. So there was no sense in going to the refrigerator to get a snack because there was none. And I've even wondered if the best way to help me lose weight is to put a chain around the refrigerator and you can only open it once for 5 seconds and get whatever you need. But we know it's a calorie problem. And of course with exercise.
And the exercise and
Yeah.
the fitness, we have a Walk Across Texas program, and we involved over 17,000 kids this last year, on walking programs, because there is no exercise, especially for the elementary schools. We had 17 of the elementary schools to participate, working with Aroma and Rio Grande City, using the coaches, in there, and they had to walk 800 miles across Texas, but we just need to support all these educational programs, like you said, Dr. Falcon, and get back to the schools and get them all moving and working together with the community and everything, because education is the only thing that's going to change it.
Thank you. Thank you both. Dr. Vasquez, is there, from your perspective, if there's any other biggest challenge in the healthcare industry at this moment that you'd like to share with us?
Yes, Ms. Guillén, and I agree with Dr. Falcon. The education aspect is very, very important to try to promote our health. I am not going to go any further in that. I want to mention about a significant problem that I see now and coming to the future, and in specific to our county, okay? Not that much to the region because we do have, even though we are one big area altogether, as Dr. Cardenas mentioned, there are not really boundaries here. I am going to talk on the Stark County perspective, okay? So as the time goes by, we are finding more and more difficult to have primary care physicians coming to serve our community. We have found throughout the years a significant number of specialty services coming down to our community to serve, and that's greatly appreciated and that's much needed. However, the foundations of a healthcare system is the primary care. And it's been years now since we got our last primary care physician coming to be living and serving this community, okay? So we definitely have a problem in hands. We are not growing any younger, okay? We are still years away from retirement, but unless there is a replacement population, there is a new generation coming to serve these communities, we are going to face significant problems because if you don't have the basis, you are not going to have never the top, okay? So that foundation needs to be here and we need to encourage, we need to look at different venues to try to promote and to incentivize these young doctors that are getting graduate all throughout the state and the country to come and serve in communities like ours. That has been difficult. 20 years ago, the time when I came here, there were several programs all tied up to immigration laws that they were helping a lot foreign physicians to come to serve these communities. Those had been every day less and less available and more scarce. So as an end result, we have found that the number of applicants or the number of people interested in coming to serve rural communities is dwindling and is getting lower every day. This is not just exclusive for us, for Stark County, but that has happened in every other rural community throughout the state. So I think that that's a big problem. My point on this is look at different venues, and those are many, okay? All throughout the scholarship programs, loan forgiveness programs, reopen waiver programs for foreign students to come to serve communities like that. All of those are valid points to try to solve this problem that we have.
Thank you, Dr. Vasquez. It's the shortage of physicians in rural communities is something that continues, and it's extremely challenging to with lack of resources to bring some of these doctors who are willing to serve in our communities. I also think that we're growing from within with the medical school, and that is excellent, excellent. And if we can drive and drill down to these students to stay in the valley, and I know Doctors Hospital has done a lot, and of course, Dr. Vasquez, I hear about students rotating through Stark County Memorial Hospital. That's excellent. It shows the need, it shows the want to have these young physicians stay in our community. And of course, we're very thankful you chose to come to Rio Grande City. Dr. Cardenas, I know you have served on state panels and as chairman of the Texas Medical Association. You've probably seen also, across the state, all of the challenges in the healthcare industry. But what would you say is the biggest challenge in healthcare industry at this moment?
Well, I want to look at it from a couple of different viewpoints. One on the global, on a 40,000-foot view, there were some major challenges that are, I think, and no different than they are here. And that is, there's a major challenge in IT, in information technology, in the interoperability between systems. So if a patient from Illinois moves to Rio Grande City, getting those records, being able to care for that patient lockstep, that system doesn't exist today. Mandated by the Obama administration, no delivery. There's been very little movement on interoperability between systems because of the proprietary nature of what is information technology. That's a challenge. That's a real challenge for us go forward. Locally, we can solve some of those challenges because if you're within one system, you would think it'd be relatively easy to talk within a system. Well, I have news for you. It's not as easy as you think. because there are walls within companies, even though you may be on the same platform, sometimes the two platforms don't talk to each other. And that costs money to be able to fix that. So that's one challenge. The other thing that's happening across the country and in the state is a consolidation between major health systems. That's going to drive up the cost of care long-term, and we need strategies for dealing with that. More locally, I think we have the challenges that have already been alluded to by both of my colleagues in terms of being able to recruit and retain the talent that we need to help care for our population. I think the establishment of the medical school, which was a dream of this entire community, is going to go a long way to help make that a reality. We have established residency programs and now 2 fellowship programs, more, well, actually, yeah, at least 2, maybe 3 now, one in cardiology and one in gastroenterology. And some of these individuals are going to stay within our community. Our internal medicine folks have stayed, many of them as hospitalists. Some of them are coming and working up here in the hospital, helping to do that. I know that we've had an opportunity to serve as a gastroenterologist in this community 3 different times in my career. I'm here again for the 3rd time, this time hoping to stay for the long term because we built the facilities to be able to care for people right here in Rio Grande City because it's too far. And that alludes to the other problem, which is a problem probably for the other room, but none of these things live in silos by themselves. But the truth is, 1.4 million people need access to their healthcare facilities. They need to be able to travel. When I was a young person in high school, it took me about 35 to 40 minutes to drive from McAllen or Edinburgh to Rio Grande City. Today, depending on the time of day, it might be an hour, hour and a half. Time is everything when it comes to healthcare and an emergency. Time is everything. We need definitive movement in our transportation infrastructure to be able to properly attend to the health care of our community. That's a must. As a region, we deserve it. We need to all band together, and I think that some recent moves by the counties and the cities coming together was one of the greatest things that could have happened, because we can speak with one voice in Austin and in Washington to be able to make things happen. And so I think that none of these things live in silos by themselves. Our transportation infrastructure is woefully inadequate. I think it impedes the delivery of health care. And in order to solve that problem for the long term, health literacy has to go hand in hand with access. That's what we need to do as a community.
Thank you, Dr. Cardenas. Dr. Falcon, what are the most pressing changes we must make as a community to face the future of healthcare effectively?
The changes? I would think that the biggest thing that we need to do is try to get changes in the cost of healthcare. Healthcare in this country is excellent. The cost is what is a huge impediment for especially a lot of our patients here. Dr. Cardenas mentioned the transportation situation. What may seem something very simple to us to go to McAllen and come back is an impossible task for one of my 85-year-old patients. By the time they go, they spend time over there, have to hire somebody, have to pay for them to eat and stuff. It becomes a huge expense just to go see the doctor over there. But in general, I think that we as a country need to clearly define what we want to do in the future and how we're going to be able to achieve that financially. Right now, our patients spend up to $400 or $500 on insulin per month. I mean, who can afford that when most of our patients don't make much more than that? $600, yeah. That's just way out of line. I mean, I understand pharmaceutical companies need to make money, but not at the back of regular Americans that work hard and don't really make that much money. So I think that's one of the huge things that we're looking at in the future. And of course, that's a discussion at the national level, but solutions at the national level come from local places.
Right.
And I know Carlos and I know because one of the biggest things that ever happened in healthcare in this country was tort reform, and that conversation started right here in the Rio Grande Valley, in Weslaco. One
That's why
afternoon.
this
Yes.
conversation here is important.
That's right.
'Cause
And
it
this can
starts
lead to
right here
changes
in
at a
this room.
national level, yeah.
Thank you, Dr. Falcon. Dr. Vasquez?
Yes. I think that there are two significant issues and now going towards the future. One is the patient education. It's fundamental the patients to understand their disease, the way that we treat those disease, the way the medications work, and the importance of following recommendations, okay? It goes tremendous amount of time and resources on a daily basis by physicians in serving the communities that basically do not understand what disease they are suffering and why and how to be treated. So we keep giving medications and medications and medications to patients that it sums in an enormous amount of hardship for those patients, possible consequences, enormous amount of money being utilized, and sometimes just because there is not been enough education in patients to understand why are we treating and how to treat those diseases. The other thing that I want to mention, and I believe this is a challenge, is because of the geographical area where we are, we should be seeing in the next few months or years to come an influx of people coming from other countries, okay? The immigration situation is a very hot topic nowadays, and we are at the forefront of that because of where we are located. So we have to be ready to face the challenge that could be ours to take care of an enormous amount of people that are coming from different communities, different countries, with a whole different variety of medical illnesses that we are not aware. The second aspect to that is the resources, okay? Because every day, federal and state government are cutting down in the resources that are being put into the service of these patients. The payment model have changed in the last years, where we were getting paid for service, and now we are getting paid for performance. So the whole changes in the way that the access to medical services are being rewarded have changed, and that's a challenge towards the future for us to get adapted and to survive to those challenges in face of the new possibilities that we have when we have to face the fact that our population is growing, the number of elderly is growing more and more, and the amount of people that we may need to serve because of the other factors that we mentioned, immigration, for instance, is going to be part of the equation.
Thank you, Dr. Vasquez. Dr. Cardenas, what do you believe are the most pressing changes we must make to face the future of healthcare?
I think that the changes that, some of those I alluded to earlier, one of those is I think we need a solution on the IT front for the long term. I think that the careers into the future in healthcare are going to require a higher level of education at every level as we see delivery models of healthcare and research basically go hand in hand, and so that our workforce is going to need to be skilled to be able to work in that new and growing environment. With that will, I think, come really, really good jobs. But, you know, having good jobs and having a sustainable medical community and those things requires a certain level of funding. You know, Medicaid hasn't had a fee update in more than 20 years. That's huge for our community and for the people who deliver care in our community. So it is my hope and my prayer that the legislators are listening and that we can look to try to get a fee update for those of us who see Medicaid patients, because the cost of doing business as a physician and as a healthcare provider in our community didn't stay still for the last 20 years. It's gone up, as alluded to by others in the audience and my colleagues. It costs more now to treat insulin-dependent diabetics than it cost in the past, and the cost is prohibitive and unsustainable. Yet every aspect of the medical community, when you look at fees for physicians and other areas, there's been a lot of clamping down, but nobody's held the pharmaceutical companies in check. Nobody's held the medical device companies in check. Those are huge challenges for us long term, because some of those things may be, quite frankly, not within the budget to be able to pay for. And that translates into substandard care. So we have to have a coming together of all stakeholders in healthcare to be able to solve, I think, what are global challenges for the industry long term. I think that as a community, and I'm speaking as the larger community, we are on our way in terms of transforming healthcare in our community because we had vision and we invested early on to try to get to where we are today. And we basically went and demanded of our legislature that 1.4 million people needed an institution of higher learning to teach the next generation of physicians and the graduate medical education programs to make that possible, because we know that 60% of them will stay within a 150-mile radius of where they train, and build that community. And so I see that for our future.
Thank you very much, Dr. Cadenas. That pretty much wraps up our discussion. I know we have a pretty tight schedule and a lot of work to do this afternoon. Let's give a round of applause to our panelists. Thank you so much for being here with us this morning and for contributing to this conversation. I will remind everyone to please take a moment to complete the survey online. It is important that we get your responses so that we can have that as discussion goes on later this afternoon. Thank you very much.
Great, thank you.